delegates on the dais, off the dais. Today, my topic is on Sathya Unani in Unani and evidence-based practice. As we all know, nowadays, cancer is one of the foremost public health burdens and one of the fastest growing disease in both developed and developing countries. When we see the incidence of cancer, we can see that it is 10 millions per year. When we come to gynecology, when cancer occurs in human reproductive organs, we call it as gynecologic cancer, and each gynecological cancer is unique with signs, symptoms and risk factors. When we see that in India as well as in world, we can see that ovarian and cervical cancer are the most common gynecological cancers affecting women. In United States, approximately more than 89,000 women are diagnosed with this cancer and more than 29,000 die because of this cancer. But when we see in India, each year around more than 1,20,000 women are diagnosed with cervical cancer, and we see that more than 67,000 women die because of gynecological cancer. So we can see that in India, the death because of cancer is more. Let us come to our own system, Unani system of medicine. We all know that cancer is not a new disease. It's a very old disease, and it was first described in Edwin Smith Papyrus in about 1700 BC. And we all know that Hippocrates in 400 BC has given the word carcinoma, and the cancer has been derived from this Greek word. In Arabic, we call it as sartan, which means crab or creeping ulcers. Eminent Unani physicians, for example, Bukhrat, Jalinus, Al-Razi, Al-Zohrawi, Ibn Sina, Jurjani and others all have said about sartan. And they said that the sartan is caused because of burning of Khilte Sauda. Then Jalinus also said that he has described cancer of the uterus in his manuscripts, and he classified the cancer in the tumors into three, that is lumps or masses, non-ulcerating and ulcerating cancers. Jalinus also said that when the cancer is in initial stages, we can treat through removal of humus or khilt, and we can use topical anti-cancer drugs. But in advanced cases, he said that we have to use mussel, and the tumor root should be removed, along with the vessel should also be removed, and it should be pressed to remove all the blood. When we see the etiology, as we all know that, as we have already studied, the cancer is caused because of burning of different khilts. That's why I'm not going to go in detail, only I'm going to give you a gist here. Sartan occurs in soft organs and organs with high vascular supply. This has been given in our books, and whatever I'm saying, it is from the reference of our books. And they have said that the sartan can be seen in breast, uterus, testis, prostate, lungs, stomach, pancreas and oral cavity. As they said that it is common in soft tissues. And they also said that it is common in nerves, muscles, tendon and limbs. And Ibn Sina said that the prevalence is higher among females. Ibn Sina said that the cause of cancer is increase of innate heat, which causes eterach of khilt, and it converts to sauda, which gives rise to tumor or sala. At early stages, cancer growth is unapparent, but after progression, treatment of sartan would be difficult. In some cases, manipulation of this tumor may lead to ulceration. Al-Razi, he said that sartan is vermis sulb of rahim, and here the roots are stony hard, reddish in color, and when it occurs in anukhul rahim, that is in cervix, it is associated with low back pain and lower abdominal pain, and the lesion may be ulcerated or non-ulcerated. That means they have said about the cauliflower growth of the cancer as well. Al-Razi said that in the initial stages of cancer, regular first and administration of mucil sauda is advisable and should be given to prevent the accumulation of the disease forming khilt. In addition, blood thinning foods with cold nature should be administered to the patient. Al-Razi also has classified the tumors into benign and malignant, and he has said that not only tumors, we can see that there are some heart swelling formed in the body which are similar to sartan, but they are not sartan. And this heart swellings can be associated with pain or without pain. and these are secondary to Varmehar. In contrast, sartan is formed primarily, and another feature is that the vessel adjacent to non-cancerous swelling are stressed and have lower temperature upon touch compared to cancerous tumors. For pelvic swelling, this is the best sign of their benign nature. Then when we come to gynecological cancer, we see that it can occur, but when we see our own books, they have not described the cancer of each and every organ. They said only sartan-e-rahim. That means they included all the reproductive organ cancer in sartan-e-rahim, and the treatment is also same. When we see the clinical features discussed in Unani classical texts can be correlated with clinical features mentioned in conventional medicine, that is they are same. Patient may have abnormal uterine bleeding, vaginal bleeding, feeling fullness, too quickly of difficulty in eating, pelvic pain, more frequent or urgent need to urinate or constipation, bloating, abdominal pain. Not only the specific symptom of the organs, but they have said that their associated features like pain in eyes and temporal region, migraine, excessive tiredness, cold extremities, excessive perspiration, ascites, giddiness, and other symptoms also. Bukhraj said that whenever a doctor cannot do good, he must keep from doing harm. In cancer, this rule is applicable. Principle of management. Mainly, all the Unani physicians emphasize that to prevent the collection of black bile or kilte sauda. So how can we prevent the collection of kilte sauda is to use some dietary regimens, regimenal therapy like first of basilic vein followed by first the saffron or saphenous vein and other regimenal procedures, use of purgative drugs of black bile, use of laxative and anti-inflammatory drugs to resolve inflammation, and local use of analgesic and sedative to relieve severe pain. So prevention of cancer can be done by following asbab satya zaruriya of healthy living by Unani medicine. As we see, the risk factors for cancer consist of chemicals, radiation, inactive lifestyle, unhealthy diet, environmental factors, infection and tobacco smoke. So here asbab satya zaruriya, I don't have to explain, each and everyone know. There are 6: air, food, bodily movement, psychic movement, sleep and wakefulness, retention and evacuation. How can we do it? I don't think so I have to say this slide. We all know what to do. Like if say we have to avoid extreme cold and heat exposure, fresh and pollution free. We all know this. I will skip this slide. Then use of Unani medicine in the management of cancer as adjuvant, like to restore the healthy lifestyle by following Unani asbab satya zaruriya, to enhance the immunity of the patient, to reduce the complication associated with sartan, to provide palliative care and prevent the side effects of conventional cancer therapy, to improve the quality of life of patients. This is the most important, that we have to improve the quality of life. Though we are giving conventional treatment, we are giving chemotherapy, we are going for radiotherapy, but we are increasing the life expectancy, but we are decreasing the quality of life. Here our system plays a very good role to improve the quality of life for cancer patient. Common use of herbal medicine as adjuvant treatment in chemo radio cancer therapy. I am sorry to say that we don't have any research done in Unani system of medicine to say that we have evidence-based practice, but we are having researches conducted in other traditional system of medicines like Chinese medicine, where they have said that clinical studies have proved that beneficial effect of herbal medicine on the survival, immunomodulation and quality of life of cancer patient when these herbal medicines are used in combination with conventional therapeutics. So here are some studies where they have done, and they have said that when we give adjuvant therapy of herbal medicine, it helps in improving quality of life. To provide palliative care and to prevent the side effects of conventional cancer therapy, we know that CDC has listed so many symptoms like anemia, appetite loss. In all the symptoms, we can give palliative care. For example, in anemia, we can give sharbat-e-fawlat, majun-e-azar-akhi laham, sharbat-e-ward. Appetite loss, as we all know, jawarish-e-bisbasa, habbe-tush, namak-e-suleimani, all this can be given. In bleeding, we can give sharbat-e-anjabar, khurse-e-korba, khurse-e-kafur, khurse-e-sartan. Like that, in symptoms, whatever we use in routine, that same drugs can be used in cancer also. Then like that, there are other symptoms where we can give our medicines. Like for example, if there is infection, we can give khurse kafur, arke, harabara. Like that, we can give many drugs. Unani regimental therapy is excellent way of improving quality of life in cancer patients. We all know that. We know the regimes, that is dalak, hammam, shummum, riyazat, hijama and fast. This all can be done in cancer patient to improve the quality of life, to relieve the symptoms. So research studies And this research studies are done in other traditional system of medicine, not in our system of medicine. We have to start all these things. A systematic review on massage and a randomized clinical trial examined the effect of massage on pain, relaxation, comfort and sleep. And they said that doing massage or dalak is anxiolytic, reduces pain, increases sleep pattern. Again, therapy on hammam, randomized control trial was done, and they have seen the role of hypothermic baths in depressive order, and they said it was effective. Then spa therapy. In another study, the spa therapy show a potential approach for breast cancer rehabilitation, which was found to be effective. Like that, systematic review for aromatherapy for cancer patients to reduce anxiety level and relief of emotional stress, pain, muscular tension and fatigue was done, was seen, and it was beneficial in these cases. What was the effect of aromatherapy? Linalool in lavender oil, that is, it inhibits the glutamate binding in rats, augment GABA, reduces anxiety, stress, muscular pain and fatigue. Scent receptors in the nose send chemical signals via olfactory nerve to limbic region and therefore affect person emotional responses, heart rate, blood pressure and breathing. Because of short time, I am not going to explain each and everything. I am really extremely sorry for that. Like diet, we all know that diet is a very important. Nowadays, in any disease, they are saying for diet and exercise. So we should know what are the diets advised during in patients of cancer and what are the advice we should be diet we should be restricted in the patients. So hot and spicy food item that produces black bile or khilte soda like brinjal, karam kalla, beef, all this should be avoided, whereas nutritious and easy digestible diet like chicken, soft meat, chapati, spinach, beetroot, grapes, fig, and this can be given in the patients. Evidence-based food items having anti-cancerous effect, whatever we use in our home, that is garlic, turmeric, ginger, beetroot, cabbage, all these are having anti-cancerous effect. We should start using all these things, and a research has shown that pomegranate juice and its component inhibits metastatic process in breast cancer cells. Strawberry fruits carry preventive and therapeutic property towards breast cancer. So daily we have to increase the fruit intakes as well, because it is having natural antioxidants which prevent cancer. Then when we come to route of administration of DEC, we know that they are oral and topical. In oral we are having different forms like Sufu, of course, Joshanda, Majun, Javarish. In topical we have Humul, Abzan, Abdast and Zimadat for Jaza. So here Ibn Sina described that use of local medication for 4 purposes, because we see that only in our system we have local medication for cancer. Whereas if you go in conventional therapy, we see that they are having now they are coming to gene therapy and immunotherapy. Previously they were only going for chemotherapy. So here Ibn Sina said that we should use local medication for 4 purposes: for total arrest of the cancer, preventing its progress, preventing ulceration and treatment of ulceration. So here they have given many medications which can be used in the cancers. So here these are the medications which has been listed in the classical text in the heading of Sartan al-Rahim. So all these drugs can be given in Sartan. Oral we can give Joshande Aftamun, Joshande Unnab and Sipista. Like that we can use Humul of Marame Dakhilun, Marame Ris. Absence also we can use like Khitmi Hulba Alsi. This is for pain. Joshanda of Khitmi Hulba Alsi can be used for pain. Like that we have Zimadad also. Now let us come to evidence-based practice. Why we are saying that our system is till now working after so many years? Because the plant compounds are having natural derivatives which helps acts like antioxidant, which helps to treat cancer or to prevent cancer. The plants derived compounds are easily available, cost effective and possess minimal side effect. Plants, how they act in cancer is they inhibit cancer cell activity, inhibits proliferation of cancer cells and angiogenesis, induces apoptotic cell death. How it causes inhibition of proliferation of cancer cells is directly by stimulating macrophages, phagocytosis, enhancing natural killer cell activity, and here increases production of interferons 1, interleukin 2, immunoglobulins and complement in bloodstream. So here we have seen that Razi has recommended 131 plants in cancer, and Ibn Sina has given 55 plants which can cure cancer but in initial stages. There are 36 common plants describe over 27 families, and both physicians have highlighted the property of these drugs. So one of the review against cancer, they listed that there are 3,000 plant species which are useful in cancer. India is the largest producer of medicinal plant and is rightly called the botanical garden of the world. So we are having good number of plants. Medicinal plants have been stated to comprise about 80,000 species and account for approximately 50% of all the higher flower plant species of India. So here the natural compounds acting as cancer therapeutics, flavonoids, saponins, we all know that. These are the plant compounds which are useful in cancer therapy. So here we see that in initial stages in chemotherapy also plant derived extracts were used as a chemotherapy, like we know that this vincristine, all these are plant derived compounds which are used as a chemotherapeutic drug, and they are having antimitotic activity, they have microtubule inhibitor activity, and we see that initially chemotherapy drugs are all plant derived drugs. Then curcumin was done in breast cancer, it was used and it was found to be anti-cancerous. Like that many drug trials are going on and they have been done and they have shown that they are having anti-cancer properties. Then phytoestrogens, water soluble isoflavones and lipolignins, these both are also helpful in the cancer cases. Among 6 related clinical trials, one clinical trial concluded that isoflavone was associated with reduced risk of breast cancer. Then Al-Zohrawi is the first to conduct classical removal of the breast cancer. He recognized that the cancer can be treated surgically only in its early stages when complete removal is possible. Future prospectus, extensive research is required to find out the mechanism of action as well as bioactivity of various phytochemicals and efficacy of the medicinal values of these plants. So in the near future, extract from these plants could be future exploited as a source of useful phytochemical compounds and may play a very important role in modern system of medicine. Unani classical texts are enriched with knowledge pertaining to gynecological cancer for the prevention, palliative and cancer treatment. Unani herbal based medicines are useful for palliative treatment and cancer therapy with low toxicity and minimal side effects. The plant used are mostly in crude form and still need advanced research for the isolation of phytochemicals and establishing its cellular and molecular role in treating cancer. Thank you. Our institute is the first institute to get NABH. And lastly, I like to say that there is no end to education. It is not that you read a book, pass an examination and finish with education. The whole of life, from the moment you are born to the moment you die, is a process of learning.